Welcome to Face to Face. I'm David McCarthy, co-convener of the Victorian Gay and Lesbian Rights Lobby. Tonight it's my great pleasure to introduce Mike Kennedy, the Executive Director, Victorian AIDS Council, Gay Men's Health Centre. How are you, Mike?
Hi, David.
Good. Now, in the news lately, we've had a little bit of a controversy, I suppose. The recent HIV figures have come out for last year. What stage are we at in the epidemic now?
We're at a point in the epidemic where we're looking at figures that we had back in the early 1990s before antiretroviral drugs became available, and that's an area for concern. In Victoria last year, the figures that have just come out from the Department of Human Services show that there were 234 newly diagnosed cases of HIV. That's an increase of 7% on the previous year, 7% on the year before that, and that was the big jump that we had in 2001.
Which was 40.
Which was about 40%. So we've really gone from a low point in the epidemic of about 140 in 1999 to 234 3 years later.
Okay. Now in those figures, what component is men who have sex with men? How is that travelling?
That hasn't changed much over time. We're still looking at around 85% of the epidemic being there. Mm-hmm. And over time there's been very little change in that. Some slight increase in the number of heterosexual cases, but they're mostly from either people who've come from countries with big epidemics or people who've had sex with people who've come from those countries.
Okay. So this would give us a HIV population, Victoria, HIV positive population of 3,000?
Yeah, a bit more than 3,000. It's a bit hard to tell because the only way that you can come to that figure is by taking the number of HIV notifications and taking away the number of HIV-related deaths. That doesn't take account of the fact of what might be happening with interstate migration.
Right.
But essentially, I think the point that we can make is that we now have more positive people living in Victoria than we've ever had, and that's because since 1996, when antiretroviral treatments became widely available and positive people started taking them, the death rates declined significantly.
Yeah.
So we've got two things that are happening in Victoria in relation to the epidemic. We've got an increase that is clearly now not a blip, it's a sustained increase, and we've got more people living with HIV in Victoria than we've ever had.
Okay. Now with each, I know it sounds a bit mercenary, but with each new infection, you're looking at a cost to the health budget moving forward for the life of that person of about $500,000. So, in the last 3 years, we're probably talking about, $250 million that is going to be added onto the health budget moving forward. What's the level of HIV funding in Victoria, and where does most of it come from?
It's a bit hard to tell what the level of HIV funding is in Victoria, and this is one of the issues that the review of the fourth National HIV strategy, which was completed last year, has highlighted as a problem. There are difficulties at the moment, I think, with both Commonwealth and with state governments. At the Commonwealth level, the Commonwealth had a mid-term review of the fourth National strategy. It made a number of recommendations where it thought we needed to improve the response at a national level. One of those was to make the point that, particularly in relation to gay men's health promotion, but generally in terms of the way in which we're rolling out the response in both the hospital sector and the community sector, it's impossible to track the money. Yeah. It's impossible to track what's coming in, and it's impossible to track what's going out. Commonwealth ministers had that report since November, December of last year. We still haven't got that report released, and there's no indication of when it might be. So at the Commonwealth level, we think that's a pretty clear indication that the government's dropped the ball on it.
Okay. Now, in terms of Victorian AIDS Council, would I be right in saying that the funding for the AIDS Council has pretty much remained static, that it hasn't increased to any substantial extent over these last 3 years?
A couple of ways of looking at it. Since about 1996-97, the money that's spent on AIDS in Victoria has come from the Commonwealth to the state. That payment each year is indexed, so as well as the previous year's payment, the Commonwealth pays an indexation figure. Twice in the 7 years since that happened, so previous Kennett government and then the Bracks government, in only 2 of those 7 years has that indexation figure been paid across to the community sector. So Victorian AIDS Council and every other organisation in the community that's funded out of those dollars has essentially had funding that's been pegged at 1995-96 levels. When the increase happened in 2001, the government put an extra $500,000 into the response. We've spent that money. There's no indication that that's going to be ongoing. They seem to be in a position that says this was a one-off and the thought was that that would fix it. Well, that's clearly not the way that it's going to go. Anybody who's trying to run a budget, anyone who's trying to run a household budget, anyone who thinks that that's okay should go off to, we won't mention a store because it'd be advertising, but go off to anywhere that you like and say, I want to buy something now and I want to pay the price that I paid for it in 1995, and they'll say to you, there's the door of the shop. Everybody knows you can't do it, and yet governments at the Commonwealth level and at the state level in Victoria, both Liberal and Labor, think that we can keep rolling out those kinds of services for the same kind of prices as they were paying in 1995, and we can't do it.
Even though we've got the very real situation where that HIV population has increased, it's obviously there's a much, much greater need for education, yet the money's not forthcoming. I mean, I'm puzzled as to why governments of all persuasions, state and federal, don't seem to want to spend the money when there's this huge impost that's looming in the future. That surely that old thing, an ounce of prevention is worth a pound of cure. That they don't want to spend the money on it.
I think it's 2 areas. I think there is the issue that says governments don't plan far enough ahead. You've talked about projected health costs for the system as opposed to money that you need to put in now. Certainly we need to be spending more money than we're spending on health promotion to prevent what's happening. Part of the complexity of this is I can say to government, I can't guarantee that if you put more money in, we can drive those figures down. In fact, they put $500,000 in and the increase has diminished, but the figures are still going up. I can't say that if you put money in, we will guarantee to turn it around for you. But what I can say to them really clearly is if you don't put more money in, they're not going to go down on their own. Yeah. So in terms of prevention, they need to be spending more. But we also need to recognise that we've got more people living with HIV than we've ever had before, and therefore the demand for support services is greater. People are trying to manage their treatments. Yeah. There's a demand there for services that isn't being properly delivered. The complexity of the issues that people who are working in the care and support area are having to address are greater than they ever were, and yet the budget that's available to roll those services out is going down in real terms. Yeah. What it's meant for us effectively is that since 1995-96, whenever costs went up or whenever wages went up, we had to shave what we were doing to be able to absorb those costs. We've done next year's budget, and that went to the department a couple of weeks ago, and that shows that to get the services that they've been purchasing, to get them next year, there's a shortfall in our budget of $300,000. Now, if they're going to come back to us and say there is no more money, it's inevitable that making those kinds of cuts to bring in a budget that balances is going to have to reduce services, and they'll be services for positive people who use the services that we provide, but also potentially a decrease in our capacity to roll out education.
I mean, positive people are already up against it. We've got foreshadowed changes to the pharmaceutical benefits scheme. We've got Minister Vanstone making very loud noises about the disability support pension. So, but let's go back a step. That one of the situations is that there's only a very few number of ways you can actually contract HIV. Obviously, one is through a needle, through sharing with intravenous drug users. Contaminated blood from a blood bank, which of course hasn't happened in Australia for some time, and unsafe sex. So what do the figures tell us about unsafe sex in terms of My perception is that there's quite a large body of HIV transmission that's happening because people aren't aware that they're positive. What do the figures tell us about that?
There's a couple of things. If you look at the social research data, there's a few things that are happening. Anal sex is making a comeback. There's more people now having anal sex as part of their sexual repertoire as gay men than's been happening in the past. If nothing else changed, you would expect that you would see an increase in HIV if the highest risk factor that was there was happening. When you look then at the kind of sex that gay men are having that we're finding out from a range of the social research, we're finding that within relationships people are dispensing with condoms, and provided they're using the negotiated safety formula, which is talk about it with your partner, have an HIV test, continue to have protected sex, have another HIV test, and have an explicit negotiation within that relationship about what will happen about sex outside of the relationship, and then be able to trust each other. There's no reason why two people who've engaged with that process, who both know that they're HIV negative, having unprotected sex together is unsafe. Equally, two people who are HIV positive who are having unprotected sex together aren't going to be spreading HIV. The jury's out a bit in terms of how safe that is for the positive person, and it's a cause of some controversy in the sector. But at least if we're talking about HIV transmission, two positive people having unprotected sex together aren't going to spread HIV. There are two ways of looking at what happens after that, though. There's one view that says the epidemic's being driven by people who are HIV positive who just don't care, and who are having unprotected sex with people willy-nilly. We don't see much evidence for that. One of the things that concerns me is that if you look at the people who seroconverted last year, if you look at those 234 people, most of the women had never had an HIV test prior to them having the test that led to them being diagnosed. And that's not surprising. They probably didn't think they were at risk. But if you have a look at the men, the 209 men who seroconverted last year, 91 of those, almost 44%, had never had an HIV test before. Now people say, well, okay, maybe they're young men and they just hadn't got around to testing. But the median age in that 209 is 34. About 40% of those people were aged between 30 and 40. With about 20% on either side of it, so 20 to 30 and 40 to 50. The reason why those people haven't had an HIV test before is not because they're young and therefore they haven't come to it. So something's happening in there in terms of testing rates, and that's why we've been advocating to the department the need urgently for a testing campaign.
Okay. Hold that thought, because we're going to a break. We'll be back shortly, and we're back with Mike Kennedy from the Victorian AIDS Council. This is Dave McCarthy on Bent TV. See you soon. Welcome back to Face to Face. I'm Dave McCarthy. Tonight we're talking to Mike Kennedy, Executive Director of the Victorian AIDS Council. Gay Men's Health Centre, what a mouthful that is.
It's a mouthful, isn't it? Yeah.
Oh, it is. Now we're talking before the break about the roughly the under half that haven't previously had a test, have had an unsafe sex episode and have contracted. What do you think drives those people to actually have a test? You know, that
at this point, not having
had one
age
previously.
34, never had a test in the epidemic. Why do you test in 2002?
Yeah.
Who knows? One of the areas that is underdone in the response, and it's one of the problems that we run into in doing health promotion, is there are a whole lot of those kinds of questions that you would love to know the answer to. One of the things that the Australian Research Centre in Sex, Health and Society has pitched to the government is let's do a seroconverters study. So of those 209 men, 74 of them were identified as having not just newly diagnosed HIV, so not HIV that was diagnosed in the last year, but HIV that was acquired in the last year. So if you look at those people, and if you can get some information from those people, and in particular from the 60 men who had a negative test within the last 12 months and have now got a positive one, that's where you find out the information. But one of the things that does fascinate me is if you've got someone who's in their 30s or 40s who's not ever had a test before in the epidemic, why is it that they're suddenly deciding to have one and showing up in those figures? We just don't know.
Okay. Now the government is finally, I suppose, getting to the point of they've been saying for a long time that they're going to review the Victorian AIDS Council Gay Men's Health Centre. One, what sort of time frame do you think that's going to take, and what sort of an outcome do you think that the department wants? Because it seems to me that the department's been putting less money in, they've been paying less attention. I think they've taken their eye off the ball in terms of HIV and prevention. What do you think's driving that review, and what sort of an outcome do you think they'd like out of it? And then we'll talk what you'd like out of it.
I think it's interesting in the way that the community's thinking about this, because the immediate reaction that I've got when I've talked to people, and certainly the way gay media's covered it, seems to suggest that the reason why the Victorian AIDS Council is being reviewed is because we've got an increase in the epidemic. Therefore, it must be VAC's fault. Well,
we all know it's VAC's fault.
Yeah, that's not the way it works. So let's set the record straight.
Yep.
We've been asking. I've been in the job for 4 years. When I first came into the position, I met with the department. The change of government happened not long afterwards, and the first conversation that I had with the new person who came in when the Bracks government got in was to say, I don't think you know, as a government, what you should be buying from us or what services you should be providing generally over the course of this stage of the epidemic.
Yeah.
And there are two ways of addressing that. One was to develop a state HIV strategy, and the department got hundreds of free hours from community members, from doctors, from researchers. We've put together a damn good HIV strategy. That now needs to be rolled out. The Minister launched it a year ago. We're still waiting to see an implementation plan. But the second thing that became really apparent to me when I looked at it from my job as the Executive Director was I don't think they know what they should be buying from us. And so we were saying to them, you need to do a review of the organisation, because it had only ever been reviewed in the past when it was in some kind of turmoil.
Yeah.
That then guarantees for them that they're getting value for money, but also helps us to have the discussion with them about, well, what should you be buying now? It's taken 4 years to get agreement on the terms of reference. I think we've got them. I'm waiting to see the final signed off lot. The clock will start ticking on that from the next week or so, and the period to when the review report's due is 18 weeks. Now, one of the things that's fascinated me in this job, I've worked in the AIDS area in Queensland as a volunteer on the board and then as the president. I worked in a paid job in the ACT, so I know 3 states pretty well.
Yeah.
In Victoria, everyone that I've spoken to has a view about what VAC should be doing on whatever issue it is, whether it's counselling or the medical centre or HIV services or the way the PLC is run or education. Everybody's got a view. Some people will be pretty forthright in putting that view. Other people get into a trench and lob grenades. What we've been very keen about with this review is that it use an open and transparent process.
Yep.
So what we've negotiated with the department is that once the terms of reference are signed off, they'll put ads in the mainstream press and in the gay press saying these are the terms of reference. There are a number of ways that you as a client, a potential client, member of the community, can have your input into this process. People will be able to make written submissions, and there'll also be a couple of community forums that people will be able to come to, run by an independent facilitator, where they can say what they think about the 2 key issues. Now, both the department, there's a number of terms of reference, but there are 2 key ones, I think. And we think one is the one that is more important for us. The department agrees that it's important but has a different kind of focus, and that's not surprising. I think those 2 issues are what are the services that the department should be buying from the Victorian AIDS Council at this point in the epidemic. That's our primary interest. They're interested in that. We're also interested in the second question, which is how effectively and efficiently are we delivering those services that they're delivering. One of the things that has been the grenades being lobbed out of the trenches, usually by people who say, I'll say this as long as you don't quote me on it, is that we're probably getting enough money, we're just spending it in the wrong place. Now, we don't think that that's the case.
And these are the sheltered workshops. The people that say VAC's a bit of a sheltered workshop, that it's all about macrame and all that sort of stuff, which of course we know it's not.
I wish it was true. Send a camera crew and follow around me or any of the staff for a week, and if it's anything but a sheltered workshop. But the people who say that, and I think there's some people in government who think that as well, don't know what it is that we've done, because in terms of our strategic planning, in terms of our annual planning, the issue that drives the board, and because it drives the board, it drives me and it drives the staff, is how can we make sure with limited dollars that what we're doing is relevant at this point of the epidemic. And so over the past 4 years since I've been in this job, we have done reviews of the three major areas of work. We did an internal review of the education program. We did, and people would remember it because there was some fallout in the gay media about it. We did a review of the Positive Living Centre before we moved it from Ackland Street into Commercial Road, and we did a review of the community support program as well. Now, the primary question that drove those reviews is, what should we be doing so that what we're doing is relevant in the epidemic the way it is now? That those reviews suggested in each case some structural changes, but it also suggested some changes to the programs. The two reviews in the HIV services area, for the services we deliver for positive people, we paid external reviewers to do that work. With some pain for the organisation, we implemented those reviews. And so we say the department hasn't changed because it's still working with a policy framework and a funding framework that's in 1995 terms. Why we have no fears of this review is that we've changed our services, we've modified them, we've looked at what we're delivering, and we've done that by engaging with the community who use those services. I'm happy that we can satisfy the reviewers that what we're doing is relevant and has kept pace with the changes in the epidemic. But the opportunity will be there for community members to put their contributions into that and have those taken into account, and the process is a pretty open and transparent one.
Okay. Now, if you had a wish list, Mike, in terms of what would be the, how much extra money do you think is actually needed to be spent? And I think there needs to be a greater commitment, not just in money, but in terms of resources at Department of Human Services to HIV. But what would be on your wish list?
What's the wish list? There's a few things. I think now that we've got that state strategy, we've got a pretty good blueprint for rolling out the kinds of services that Victorians, and particularly Victorians in the gay and lesbian community and the positive community, ought to be able to demand from their government. We've said that we need an extra $300,000 to deliver the current level of services, but we've also identified another $1.5 million that we could spend that is consistent with what's in the state strategy. And the discussion with government is obviously going to be, how do we then roll that out and what are the priorities? I'd be happy if we could have that discussion. One of the things that's really frustrated me over the past 4 years is an inability to engage with the government around what they think we should be doing or what services they think we should be delivering. And I think one of the things that I've seen happen as someone who used to work in the public sector, one of the things that I've seen happen with the current Commonwealth government and also with the Victorian state government under Jeff Kennedy, and it hasn't been reversed when the Labor Party came to power, is they have stripped away from within the bureaucracy that level of middle-level policy people who were in touch with what was going on the ground in terms of human services, but could also talk upwards in terms of service planning. Now, those people were taken away under Kennett, and the Labor Party hasn't put them back. And therefore, we've got governments who don't know what it is that they should be doing. We've been very proud in this country over the 20 years of the epidemic that the Australian way of doing it is a great way. And it frustrates the hell out of me that I go to international meetings where I hear bureaucrats and ministers standing up talking about how fantastic the Australian partnership is. Now, that partnership is a partnership between governments at all levels, between the medical and the research communities, and between the infected and the affected communities. What I see at the moment is The last two, the medical and research community, the infected and affected community, are ready to step up and engage in the debate. I see government not being able to do that. And what I think we've got is we've got a three-legged stool with one wobbly leg, and that's the government leg. And what we say to the Minister is, you need to fix that.
Well, we've got to finish there. We did ask the Minister if she wanted to appear and to answer these queries, but unfortunately by the time we went to air, we weren't able to do that. Thanks for watching Face to Face on Bent TV. I'm David McCarthy. We'll see you real soon. Bye for now.